So while we receive more questions from you, I would like to answer the question posted by Vamsi. And the question was that it got selected for MD pharmacy. Is that true, Vamsi? And was confused whether he should be pursuing it or not. So now this is a question which has got a lot of personal choices. Whether you want to do, first thing is, do you want to do MD or not? What is the purpose of doing MD? Now, MD is done primarily in homeopathy for two reasons. Either you want to learn something as a clinician, you want more clinical exposure, or second thing, you want to go into education. Now, if you want to go into education, then you can take MD in Organon, repertory, or pharmacy. The question is, do you want, when you are doing MD in pharmacy, there is very little you actually gain in terms of practical clinical knowledge. Yeah, when you are doing MD in repertory, or MD in materia medica, even in MD in Organon, you get a lot of clinical exposure, you get a lot of materia medica, you get a lot of repertory that you learn. So that adds to your clinical acumen also, your clinical knowledge also. But when you're doing MD in pharmacy, you will be primarily doing it just for the sake of becoming a lecturer in pharmacy, lecturer in homeopathic pharmacy in a college, in a government, in any homeopathic college. So it is now for you to decide whether you want to become a lecturer of homeopathic pharmacy in a homeopathic college. Apart from that, it doesn't have any scope. It doesn't add a lot to you as a clinician, and it doesn't offer you a lot of career choices also beyond that. So you need to answer that to yourself, whether you want to do it or you do not want to do it. It's entirely up to you to decide. But if it were me, I would prefer to do it in a more clinical subject. If it is possible for you to do it in a clinical subject, it's better. If you do not have clinical subject, then it's better to do in a subject like materia medica or repertory or Organon, which are more mainstream, which have more job opportunities. Because what happens is pharmacy is only a first-year subject. So even the jobs are not so many. Materia medica and Organon are taught in 3-4 years. So the number of job options are much more. You need more teachers for Organon and materia medica in any college compared to a teacher of pharmacy. You just need one teacher of pharmacy. So the number of job opportunities for somebody who is doing MD in Organon or MD in repertory or MD in materia medica, they will be far more, and they add to your clinical skills also, and you can do in MD in pediatrics also, MD in practice of medicine also. That's it.